Developing a medical device or combination product doesn't stop when you complete your design. Verification and validation, design transfer, and post market surveillance are all critical to ensuring your product is safe and effective. But without the right design controls and risk management processes, costly delays and compliance issues can arise. Hey, this is Chuck Ventura with Ventura Solutions, your go to consulting, staffing, and training partner for medical devices and combination products. In this video, we're diving into the verification and validation, design transfer, and post market surveillance stages, exploring how design controls and risk management intersect during these key phases of product development and beyond. And if you're interested in learning more about these topics, don't forget to hit the subscribe button below. We've got a lot more content like this coming soon. Let's jump in. What is verification and validation? Design verification is the benchtop testing, analysis, or review to ensure the design output, which again is your final finished product, matches or meets its design inputs. So design verification ensures that your design outputs meet your design inputs. Design validation ensures that your final finished product meets your user needs. Let's talk about this in a little more detail. Usually design verification is engineering benchtop testing or biocompatibility testing or chemical testing. It's very rigorous engineering or scientific testing at the benchtop level to ensure the design outputs meet the design inputs. Then once you pass that, you can move on to design validation, which essentially is a lot of times taking users or patients, putting them in a simulated clinical use environment, giving them the product and ensuring that the product meets the user needs. At a high level, that's the difference between design verification and design validation. Few tips to consider, things you have to think about. You do need a design verification plan. You do need a design verification plan and a validation plan, and you'll need various protocols. And then you'll have to do all the engineering analysis. You have to do verification reports and verification and validation summary reports. So, for example, a design verification plan will lay out all the design inputs and discuss how they're going to be verified. Also, we'll define things like sample size and reliability requirements, which should be based off of your risk process. That's a topic that we could go into at a different time, but it's very important to tie the reliability sample size to the risk process. So depending on the risk associated with each design input, from the trace to the risk controls, you could come up with a sample size sampling plan. And then also you have to then write various design verification protocols. Some of it you may be doing in-house, some may be going to different testing houses like biocom testing or certain chemical testing, sterilization testing, etc. And then the same at the validation level. So verification and validation is essentially the rigorous testing process. It's one of the most challenging parts of the product development process, design control process. The other thing I want to mention before I forget is every test method you use has to be validated. So that's what test method validation is, also referred to as TMV. And the one thing I'll say about that is start that as early as possible. That's another thing that you could be doing in your design input stage. As soon as you know, hey, this is a certain requirement, whether because it's related to a user need or a risk control, once you understand that you're going to need a specific design input, by the way, you should be thinking about how you're going to test it while you're creating that design input. So once you have a good idea on which requirements you're going to have, you should start developing your test methods. You should also start validating your test methods. A lot of times it's through gauge R&R studies. Do not leave your test method validation to your design verification stage. You also have to design fixtures and develop test method fixtures. And here's another kind of watch out tip I'll give you. A lot of times designing the fixtures and test method fixtures for the design verification could be more complex than the actual design of the product. So what I'm saying here is the design of the test methods could be more challenging than the design of your product. Now, this is especially true if you're doing something off the shelf. So make sure you're doing your test method verification, validation early in your design input stage, and don't push it off to your V&V stage. When you get into V&V stage, you should be ready to start executing verification testing. So you could also start writing some of those plans and protocols concurrently in the design input and design output phases. But if there's any changes in a V&V stage, make sure to follow a rigorous change control and configuration management process to ensure your overall V&V covers all of your product requirements efficiently. The other tip I will give is there's a requirement that V&V should be done on product that is representative of commercial product. Now, this is always a big challenge because you may have not scaled up your manufacturing process. That's normally the case. So just be aware that however the products were manufactured, including the materials, including the manufacturing process, however they were manufactured for design verification, any changes you make when you scale up, you're going to have to do an impact assessment, and anything that could impact the V&V, you may have to redo. So you want to be as close to commercially equivalent product as possible, and you want to justify your rationale for whatever you're doing. I think at a high level that covers verification and validation, right? Verification, testing your design inputs. Validation is that you testing against your user needs, usually a little bit more qualitative, and also could include human factor summative. Once you do all of that and you pass all your design inputs, you pass your user needs, pass your human factor summative, now you've reached the phase of verification and validation being complete, and that's a ginormous milestone with the product development process. Moving on, the next stage is usually design transfer. I'm not going to spend a lot of time talking about that here, but just know that the design transfer process is essentially building out your full device. Basically, you're making sure that everything is in place to manufacture your medical device. So that includes starting with your design outputs and reflecting on all of the design control, design inputs, building out all of your specifications to manufacture the product. What is the process flow? What are the process steps? Having work instructions for every manufacturing process. Detailing out all the equipment that's going to be used, and how is that equipment going through validation and calibration, and how are you going to deal with CAPAs and non-conformance, right? These are some elements that have to be considered. But essentially, at the end of the design transfer process, you have all your manufacturing processes defined. You'll have all your manufacturing work instructions completed. When needed, your process validations will be completed. All of your PFMEAs will be completed. You'll have a good process for non-conformance, incoming, receiving, inspection processes, in-process testing, stability requirements for manufacturing, everything for your device master record and DMR index should be completed. And this is a very complicated process, right, that requires a lot of effort. That's why it's very common and recommended to start this early in your development process, right? As you're evolving your design and you start selecting manufacturing equipment or manufacturing processes, or especially if you're going to use an existing process, making sure all this documentation is in place and up to current standards, so you don't have to go back and remediate. Or maybe you're doing some remediation on the current manufacturing process during the development process, but from a project management standpoint, it's a risk-based approach, right? How far you go into this process. But if you put it all off to the end, you're not going to have enough time, and it's going to really drag on the whole product development process. And relative to what I said about this of design verification and validation, changes to the manufacturing process are considered in the same boat as design changes. So you have to go do that change control, and you have to look at the impact to your V&V, right? So if you have an auto injector, right, and you're assembling a cartridge in an auto injector, and you've done your sterility testing, right, out of your final finished product, then you finished your verification, but now you're ramping up capacity so you can scale up your manufacturing process, and you change your assembly process. You have to do an impact assessment. You have to go through change control, because maybe you may have to redo your sterility testing. If you're going to have to base this on sound scientific engineering reasoning and logic, but this is an important watch out to be considerate of. So once you get through this whole stage, this is referred to as design transfer stage. You can now launch your product and go into some sort of post-market stage. Another requirement in design transfer that you can actually start earlier in the process that I don't don't think I touched on is setting up your post-market monitoring, your complaint management process. All that has to be in place before you launch the product surveillance plan to define all your complaint codes. Ideally, you want to map those to your risk management process. That can be done early, even in your design output and V&V stages, but that's another element that's required for commercial launch. And then after you launch and you're in your post-market, you're going to be monitoring and doing post-market, your clinical follow-ups. If you're in the EU, and this is an EU MDR product, there's a whole nother set of requirements that we could go to in great detail. But essentially, you're monitoring your product, reviewing your complaints against your predicted levels, and determining if the product is still safe and effective as planned. At a high level here, touched on all these various topics on design control and risk management. Again, we just touched on these topics. I think if you're new to this, especially on the combination product side or new to medical device product development, I think the big takeaway here is there's a lot going on here, right? This is not just documentation. This isn't something you could just do at the last minute. A general rule of thumb to go through this full design control and risk management process, including your pre-V&V testing, your engineering study loops, defining your requirements, going through V&V, human factors, you need at least a year and a half, right? At least a year and a half. And depending on how many design iterations you have to go through, it's just going to expand. So standard off-the-shelf product, minimum year and a half. Even if you're trying to get to a clinical trial, like an IND on the combo product pharma side, or a IDE on the device side, you're going to need about a year and a half minimum to go through this process. I think that's a good takeaway. And we just scratched the surface. We just touched on each one of these deliverables and a high-level overview of what they are. There is so much more detail. Personally, I've been spending the last 20 years learning more and more about each one of these, right? And still, I have plenty to learn because we're always learning something new, but it's complex processes and there's a lot to learn. But we just touched on these at a high level here in this overview. So, as a quick reminder, if you're interested in learning more about this topic and other related topics, please be sure to hit the subscribe button below, because we're going to be creating a lot more content like this in the near future. So thanks for your time. And if you need any support with any of this, right, remember Ventura Solutions, we are a high-end niche medical device and combination products consulting, staffing, and training company. So if you need any resources, right, or even a little bit of additional training or some contingent labor, whatever that is, we could support you through our staffing side or SOW project work. Just feel free to reach out to me and I'll see how we can help you. Hey, I hope you found this video helpful as we explored at a high level verification and validation, design transfer, and post-market surveillance, and how design controls and risk management play a crucial role during each stage. If you're interested in more content like this, including practical tips and real-world examples, make sure to hit the subscribe button below so you don't miss out. And if you ever need any consulting, staffing, or training support related to these topics, please reach out. My team and I will be happy to help. See you next time.